Hi, my name is Henry Low, and today my topic is human immunodeficiency virus treatments. And my school is San Jose University, and this is my student ID. So the reason why I choose this topic as my oral presentation is because I think that HIV is primarily transmitted through unprotected sexual intercourse. And I think that HIV compared to other diseases are more common in our society, and we can see. And so I think that in the college settings where intimate relationships and experimentations are common, students may be at higher risk under the HIV. And I think that by providing this oral presentation, I think I can aid students to understand more about HIV's informations and HIV's treatments to help them understand to make informed decisions and to foster a support environment. So first, I'm going to talk about the background of the HIV. So now, due to HIV's extreme mutations, capability, and vast gene sequence, there are no any full cure treatments found for HIV. And according to the World Health Organization's, the HIV virus has harshly impacted Africa the most, with 4.1% of Africans suffering from HIV. The total number of HIV patients in Africa take parts of 2/3 of the total world's HIV patient population, which is an enormous figure. And the antiretroviral therapy is the main treatment used to cure HIV. However, these treatments cannot fully eliminate the HIV virus. And there are a lot of shortcomings to such treatments. For example, ART treatment is a regular lifelong treatment, and it prohibits any interruptions of the treatments. Any interruption of ART treatments may cause virus relapse and worsen the case of the HIV virus. And moreover, the ART therapy is a relatively high-cost treatment that mostly used in development countries. The treatment is considered affordable in undeveloped countries and poverty households. So with the expense of ART therapy, this is unable to be commonly used in Africa, which is the most severe region, as I mentioned before. So another one major drawback is that ART treatments create deposit and glucose metabolism, which are both low toxicity. However, because such toxicity can be accumulated and can cause fatal damage to patients, since ART is a lifelong therapy. And finally, with correlations with clinical data, the researchers have found that there are strong correlations between high rates of heart disease, diabetes, liver disease, and cancers in ART-treated patients. So the relationship between ART and HIV is that there are limitations on the ART treatments when fighting against the HIV virus. Due to the virus intense mutation and vast gene sequence, the current ART cannot fully eliminate the virus with survival. And regarding our HIV's mutation, the ART's effectiveness also declined as the virus evolves. And according to the report, the survival rate of the virus in ART treatment is about 8 to 20%, which is very high. And with such proportion, the virus is able to relapse and worsen the illness and kill the patients, while lowering the validity of the ART treatment. And during the ART treatments, lymphomas are the top cause of cancer and the main factor that result in patients' death among the HIV-infected patients, and may be influenced by the ART therapy. So there are some noticeable guidelines for curing HIV patients regarding the issue of lymphomas. So first, the ART treatment should never be interrupted because any interruption of ART may raise the cancer risks for HIV patients. And the medical measurement for HIV patients suffer from lymphomas can still treat it with similar procedure as regular lymphomas patients. And although the HIV virus does affect the lymphomas, but based on the research data we now have, the HIV does not really cause any severe effects of the lymphomas. And if required, it is a common agreement among the researchers to show that HIV patients should also be received the autologous transplantation like regular patients have, regardless of the HIV virus. So this is the summary of the HIV-associated lymphoma. And next, I'm going to talk about the chemotherapy and ART treatment. So chemotherapy is very often used in lymphomas, but there are a lot of effects of the combinational chemical interact between the ART treatments and the chemotherapy. So the medical should be carefully used. So for example, the CYP3A4 inhibitor will boost chemotherapy's poison level. So it should definitely not be used with diarubicin or vinca alkaloids, which are often used in chemotherapy. And also, chemical in ART treatment is often used in the myelosuppression, which is contradict to chemotherapy. So should also be aware that such chemicals should never be used with chemotherapy. And due to HIV's high mutation capability, one methodology and treatment to cure HIV is through inhibitor methodology. So multiple HIV inhibitors may raise the select tensions for HIV virus and arouse fixation characteristic of the virus, which is beneficial for the treatment by lowering the mutation rate. However, there is a disadvantage of such strategy, is that this strategy may fall into the cross-resistance and lack of synergy and worsen the case of the patient. So to solve this issue, we can first identify the predictable viral variants of HIV that will be caused by the inhibitors and identify and eliminate it before the treatment. However, and such methodology is also used in the HIV vaccine design. However, the one obstacle we now face is that such mechanism will require HIV evolution model, which is remain insufficient and requires more data in the future, causing this method's function highly restricted by HIV's vast mutation gene sequence. And the next treatment is called the functional cure treatments, which is an optimal approach for the HIV patient. We suppress the process of HIV transcription into insignificant virus reproduction and little virus transmission during the interval of HIV treatments. The main goal of the block and lock strategy is one of the functional cure treatments that targets HIV to render it become a dormant status and make it challenging for the virus to be revived again. So the principle of block and lock strategy deactivates the vital gene expression of the HIV virus by employing the latency promoting agent TAT inhibitor that interacts with the ART treatments. A combination of TAT inhibitor and ART can effectively conceal the transcription of the HIV virus and drive it into a dormant status. And it's an ideal case of the strategy. The HIV virus will not be relapsed, but remain in an inactive status, even though without the presence of strategy. And this is the process of the block strategy and lock strategy. So now researchers have discovered that various plants can process effects that are able to suppress the HIV's activities. So certain medical plants have been found to be able to considerably interrupt the transcription of the virus. And this These certain plants can have effects that able to interrupt the cycle of HIV and therefore result in the inhibition of the virus. And although the mentioned plants keep the potential to turn out to be the new novel treatments for the HIV virus, more experiments and research are waited required to create a more safe and effective treatments based on these plants to fill the medical system with a new hope for the HIV patients. So these are my citations, and thank you for listening to my oral presentation. Thank you very much.